Today's webinar is brought to you by the Alliance of Nurses for Healthy Environments. We are the only national nursing organization focused solely on the intersection of health and the environment. And we promote healthy people and healthy environments by educating and leading the nursing profession, advancing research, incorporating evidence-based practice, and influencing policy. We will have 4 speakers today, and we will have a question and answer portion at the end. The recording will be sent out to everyone who registered, and there will be continuing education for today's offering. A link for the evaluation and post-test questions will be put in the chat closer to the end of the webinar. As I said, if you could put your questions in the chat while our speakers are giving their information, we will get to them at the end. My name is Sarah Bucic. I'm a policy consultant with Alliance of Nurses for Healthy Environments. And our speakers today will be Gretchen Salter from Safer States, Steve Hwazdovich from Pennsylvania Campaign's Director of Clean Water Action, Amy Goldsmith, the State Director of New Jersey Clean Water Action, and I will wrap up with talking about the PFAS toolkit. Our first speaker is Gretchen Salter. She's a strategic advisor and consultant for Safer States. Since 2005, Gretchen has been a leading advocate in the environmental health movement. Drawing on her experience as an organizer in electoral politics, she spearheaded campaigns in California to eliminate toxic chemicals from children's products and advocated for programs that improved disclosure in cosmetic products and cleaning products. Gretchen was also instrumental in creating California's comprehensive program to eliminate toxic chemicals from consumer products and served as the California representative to Safer States until she joined the Safer States team in 2015. And since then, she's been advising lawmakers on chemical policies and building new campaigns and coalitions to create a just and sustainable economy. Gretchen also performs in theater and can frequently be found hiking in the hills of San Francisco Bay. And we're going to let her take it away.
Great. Thanks so much. Really excited to be here. My mom is a nurse, and so I have a very special place in my heart for nurses. So I've got a lot to cover. I'm just going to jump right in and share my screen. Here we go. Okay. So if you go Zoom. Great. Okay. So yeah, Sarah mentioned I'm with Safer States. We're a national alliance focused on eliminating harmful chemicals from the environment. And we partner with a lot of state-based and local groups to pass state, local, and retail policies that push the market towards safer solutions. And in 2017, we saw that there was a lot of momentum and a lot of kind of chatter happening on PFAS, but there wasn't really a streamlined campaign. So we brought a lot of folks together to really figure out how we can tackle the PFAS issue together. And we came up with a 3-pronged solution. The first is to turn off the tap on PFAS to stop using it in our products. The second is to clean up contamination, whether that be in our air, water, soil. And then the third is to make polluters pay. Currently, taxpayers are paying a lot of money to clean up PFAS in drinking water and soil and air. And we thought that really that should be the job of the people who created the problem. So what are PFAS? Oh, why is it not? Sorry, just going to do that. So what are PFAS? PFAS, the basics. Folks have probably heard about this, but for those who haven't, PFAS stands for per and polyfluoroalkyl alkyl substances. And it's a large class of chemicals. Right now, we think there are more than 14,000 different kinds of PFAS out there. And they're used to make products non-stick or grease-proof. So they're used in non-stick cookware. They're used in waterproof clothing and waterproof carpeting. They're used as surfactants. They are really everywhere. They are incredibly useful because they do make products waterproof and grease-proof, which is kind of what everybody wants. The problem is that PFAS, the core of a perfluorinated compound, is a carbon-fluorine bond. And that is the strongest bond known to organic chemistry. And PFAS are sometimes called forever chemicals because of this carbon-fluorine bond. They just don't break down in the environment. And so they started getting a lot of attention, particularly in West Virginia, when a lawyer named Rob Bilott was contacted by a farmer who lived downstream of a DuPont plant and noticed that his cattle were all dying. And And this lawyer, Rob Bilott, really looked into it and noticed that it was these classes of compounds that were making not just the cows sick, but everybody in the surrounding areas sick. And he filed a lawsuit. It ended up being a class action lawsuit that was depicted in the movie Dark Waters, which, if you haven't seen, really tells the story, the initial story of PFAS very, very well. Um, but that movie really only focused on two different kinds of PFAS, which are sometimes called C8, which are the long chains, meaning it had 8 carbon chains, carbon fluorine chains. Um, and so once those chemicals started getting attention, the chemical industry started moving toward what were called short chain PFAS, which is fewer than 6 carbon fluorine bonds, and started passing these PFAS off as safer. Unfortunately, that's just not the case, because they still shared that carbon fluorine bond. They still didn't break down in the environment. And as we can see from the next slide here, PFAS are everywhere. This is a slide showing water contamination, water system contamination across the country. And as you can see, every state has at least one site that has PFAS contamination in it. The purple dots are military sites with PFAS contamination, and then the blue sites are drinking water systems. Um, Nearly every American has PFAS in their blood. Babies, PFAS are found in blood, in breast milk, and even in umbilical cord blood. It's been found in drinking water, in groundwater, in compost, in vegetables, in sludge, sludge that's spread on cropland, and in our homes due to PFAS treated carpets, cookware, and upholstery. Incineration is currently being used right now to destroy PFAS. However, PFAS really can't be destroyed through incineration, so then it gets into air currents. And scientists have found nearly 60 tons of PFAS in the Arctic, and they think that it traveled there on air currents because of incineration. We've had farms that have been threatened due to PFAS contamination. Several farms in New Mexico and in Maine have had to shut down because of PFAS contamination. Um, and firefighters are exposed to PFAS. PFAS has been used in firefighting foam. It's used to suppress oil-based fires. And so it was the number one firefighting foam of choice for the military for many, many, many years. And firefighters would do training exercises with it. And that's why we see all of the purple dots all over the places, because those are near military sites. And it's because of that PFAS and firefighting foam that that is contaminating a lot of the water. Firefighters are also exposed through their turnout gear. The gear that they wear to go fight fires is coated with PFAS, and a lot of firefighters didn't really know. I heard from a firefighter recently who said PFAS are literally killing us because it's in their foam, it's in their gear, and it's in the homes where they go to fight fire. And they've been linked to serious health outcomes, including cancer, increased cholesterol, immune system suppression, and lowered birth rate. The director of CDC's National Center for Environmental Health called PFAS one of the most seminal public health challenges in the coming decades. So this is a great slide that I like to use to show how we are all exposed to PFAS. So we're exposed really at every stage of use, whether it be the manufacture of PFAS itself, the manufacture of products, the use of those products, and the disposal of the products. So let's take food packaging as an example. So even before a product is delivered to a consumer, the production of PFAS-coated serviceware, food serviceware, is polluting the environment. The Environmental Defense Fund looked at data reported to the FDA and found that paper mills are reporting between 100 and 200 pounds of PFAS being put into waterways every single day. So during the use of that foodware product, the PFAS leach into the food itself. And then once it's thrown away, it leaches out further, and whether that be into landfill, whether that be into compost. And so PFAS is, used everywhere. And so it is therefore everywhere you can find it. And then the last piece where I talk about compost is so frustrating because a lot of folks have switched to paper food packaging as a way to avoid plastic food packaging. But then if it has PFAS on it, it's really not any better for the environment. So as I mentioned, there are a number of different health concerns surrounding PFAS. As I said, 99% of us have it in our bodies, and it's been linked to a number of different health challenges that I've listed out here. One of the big problems around COVID is that we saw that it leads to decreased vaccine response. And while we haven't seen any studies about PFAS and COVID vaccines, we have seen studies on PFAS and other types of vaccines. And so it really just, it, it is a class of chemicals that really belong nowhere near anybody. It's led to serious birth defects for workers who have worked with PFAS, but it's linked to a whole host of different health concerns. And the more we study it, the more we find. Um, Linda Birnbaum, I don't know if folks know who she is, but she was the former director of the National Institutes for Environmental Health Sciences. And she's saying that PFAS affects tissues in all stages of developmental life. It isn't just cancer, it isn't just effects on the immune system, it's not just effects on the kidney or liver, but it affects development, reproduction, and pretty much every single system that you can think of. And the cleanup costs for PFAS are really quite staggering. Safer States developed a website called Nonstick Nightmare, where we calculated all of the costs that have been associated with trying to clean up PFAS. And these are just two of the states you can see here. These numbers actually might be a little bit outdated. Michigan so far has spent over $139 million trying to clean up PFAS. New York has spent about $752 million trying to clean up PFAS. And so a lot of the cleanup has really been, military sites, but if it's everywhere, water systems are having to clean it up and they pass that on to ratepayers. So it is a massive, costly contamination. And in fact, I heard a scientist the other day say for every penny that we spend remediating lead, we're going to spend $1 remediating PFAS. We're talking about PFAS today, but PFAS really are not the only chemical of concern. We have found recently that chemicals, plastics, they're crossing what scientists call the planetary boundary, meaning that we are beyond our ability to be able to deal with them in the environment. Safer States also works a lot on plastics. Plastics are inherently toxic, and PFAS are used a lot on plastics, we have realized. Fluorinated gases, fluorinated plastics are used in certain kinds of plastic containers, a lot of pesticide containers. And so that's why we've seen PFAS show up in pesticides. But we've also seen other additives in plastics, like phthalates and bisphenols, that are linked to infertility and developmental harm. So I know this presentation is really supposed to focus on PFAS, but it's not just PFAS. And so really we're living in this chemical soup, as I like to call it, and nobody's really done any good experiments to see what actually happens to us when we are exposed to this many chemicals at a time. The good news, though, is that a lot of states are starting to act on PFAS. So these are all of the states that have adopted PFAS policy in the last few years. A lot of states have really focused on firefighting foam, but a number of states have banned PFAS in food packaging, in textiles, in clothing. And then we have 3 states, Washington, Minnesota, and Maine, who are taking a different approach to PFAS. So Minnesota and Maine have banned all non-essential uses of PFAS by 2032. Those programs are currently being implemented, and it's a little it's a little bit of a sticky wicket right now trying to implement those programs, but really the whole idea is to get PFAS out of products wherever possible. And Washington is really taking a different approach, looking at if there is a safer alternative that is already being used to PFAS, the use of that PFAS needs to be eliminated. Eliminated. Sorry, it is a little bit, I'm on the West Coast, so it's just started my day out. So here's a state really kind of listing out what states have done. 12 states have banned PFAS in food packaging. 8 states have taken it out of carpets, rugs, and aftermarket treatments. 6 states are looking at eliminating it in cosmetics. And 12 states have banned the use in firefighting foam. And we've had 32 different retail chains who are eliminating or reducing PFAS in food packaging, textiles, or other products. And the reason that states have had to act is that the federal action on PFAS has been pretty slow. We do have some proposed drinking water standards for PFAS. There are 9 PFAS that are going to be added to RCRA, which will lead to some federal cleanup standards. But again, PFAS comprises, but we have about 14,000 PFAS, and looking for 6 or 9 really isn't going to do the job. And so we don't have any national regulation of PFAS to air or wastewater or directly to river or streams. There's no regulation of waste disposal. There's no real regulation on reporting industrial releases. So the fact that states are leading the way, they're going to have to keep leading the way because federal action has just been really, really slow. So what can you do? Nurses, I'm sure as you know, nurses are, I think, the most trusted profession in America. And so you all sit in a really unique position to be able to help end the PFAS crisis. So the biggest thing you can do is be a validator. When someone asks you about PFAS, tell them, yes, PFAS is a big problem, particularly when lawmakers or the press come to you, you know, come out and say PFAS is a problem. Testify on behalf of bills that are going through your state, and you hear some later. Join groups in your area. Look at Safer States website. We have groups listed in several states. Talk to patients, talk to lawmakers. We need folks like you to be able to take action on PFAS to end this crisis. So that is what I have. I'm sorry it was so rushed, but there's a lot there. So I'm going to go ahead and stop my share and move on to the next. So thank you so much for having me. I appreciate it.
Thanks so much, Gretchen. That was a great overview. We're going to turn it over now to Steve Hvozdovic. He's the Pennsylvania Campaigns Director for Clean Water Action and is a lifelong resident of Pittsburgh and a graduate of University of Pittsburgh. He joined Clean Water Action in 2008 and initially focused on community organizing efforts in Pittsburgh suburbs around air quality issues, and in 2010 shifted his focus to becoming the organization's point person on Marcellus Shale natural gas drilling issues. In his current role, he oversees Clean Water Action staff in the Pittsburgh and Philadelphia offices and helps to develop, implement, and oversee local and statewide issue campaigns the Pennsylvania team works on. Steve has traveled all over Pennsylvania lobbying elected officials, organizing and educating people on a variety of health and environmental issues. Steve, you want to go ahead?
Thanks, Sarah. As Gretchen said, it's a pleasure to be here today with all of you and to share some of what's happening around PFAS in Pennsylvania. You can go to the next slide. So who is Clean Water Action? So Clean Water Action is a national nonprofit environmental organization with over 1 million members nationwide. We were founded during the campaign to pass the landmark Clean Water Act in 1972. And since then, our mission has been to protect our environment, health, economic well-being, and community quality of life by bringing issue expertise, solution-oriented thinking, and people power to the table to win strong protections. I'll let my colleague Amy talk about the setup that exists in New Jersey, but in Pennsylvania, we're 80,000 members strong. We have offices in both Pittsburgh and Philadelphia that are staffed with both directors, managers, and community organizers who are working on this and a variety of other environmental issues. I think one of the things that separates Clean Water Action from some of the other environmental advocacy groups that might be out there is that we have a canvas system as well in place, both a door-to-door and a phone canvas system that talks to residents on a nightly basis about the organization, but about the issues that we're working on, and tries to get them engaged to pressure decision makers around the important environmental issues that we're working on. Next slide, please. So Pennsylvania is unique when it comes to dealing with the environment. And what separates or makes Pennsylvania unique, I think, and merits just a mention here, is that we're one of a handful of states to have enshrined quality of the environment in our state's Bill of Rights. And so our state constitution in Pennsylvania was amended back in 1967 to include Article 1, Section 27, which guarantees the people to have a right to clean air, pure water, and the preservation of natural, scenic, historic, and aesthetic values of the environment. This provision within our state constitution has actually really been strengthened within the past decade, thanks to a landmark Pennsylvania Supreme Court ruling in 2013, Robinson Township versus the Commonwealth of Pennsylvania, which was around fracking, but utilized this environmental rights amendment as part of a justification for giving municipalities greater ability to protect their residents from natural gas drilling operations. And because of that, now, like, we're really relying and focusing on this as we deal with other environmental issues as the framework for the power that the people of Pennsylvania have and the rights that Pennsylvanians have. Next slide, please. So let's talk about the actual issue we're here to talk about, which is PFAS. So in Pennsylvania, we have 30, this slide is actually, there's a little bit of a typo there. We actually have 39 identified contamination sites across 19 counties in Pennsylvania, sites that were identified by the DEP. These sites are broken down, they're primarily airports and military bases, but they also do include fire training facilities, landfills, areas that have been declared Superfunds, and areas that fall within the Hazardous Sites Cleanup Act. And so regardless of what sites we're talking about, the most prominent source of contamination in Pennsylvania has been from Class B firefighting foam that contains PFAS, something that Gretchen had previously mentioned, and something I'm going to get a little bit more in detail to here in a couple of slides. But in Pennsylvania, signs of contamination really started to emerge around 2011, when we noticed it in a couple of municipalities, Horsham, Warminster, and Warrington in southeastern Pennsylvania, in Bucks, Montgomery County border area. And those municipalities and the drinking water wells within those municipalities were contaminated by nearby U.S. Department of Defense facilities, the Horsham Air Guard Station, the Willow Grove Naval Station, and the Naval Air Warfare Center. And it was the use of firefighting foam on those sites and running off of those sites that had impacted residents' drinking water wells. And some of these wells saw nearly 100 times more than the EPA's 70 parts per trillion guidance limit, and needed to be taken off of public water or well water and put on some type of public water system in order to ensure access to clean and safe water. They're still dealing with this issue to this day, and are recently doing having blood tests done as part of an ATSDR study, and have had 1,000 residents participate in it. There's also a grassroots community group that is formed around this issue, Bucks Montco for Safer Drinking Water. I would encourage Googling them and checking out their site. They go into a little bit more detail in terms of just the severity of what the PFAS contamination has caused within their community. Next slide, please. So having a little bit more background on the problems we're facing from PFAS, what is Pennsylvania doing? And so we have started to make progress, certainly not as much as other states have, but our real benchmark in terms of progress was that in 2018, under then Governor Wolf, a process was started or initiated within the State Department of Environmental Protection to develop the state's first ever maximum contamination level for drinking water for PFAS. And so DEP developed a sampling plan that included several rounds of sampling water sources from various controlled sites, meaning not necessarily known to have PFAS contamination across the state, and utilizing that to set our maximum contamination level, which you can see they did for PFOA at 14 parts per trillion and PFOS at 18 parts per trillion. And you can sort of get a benchmark for how that might relate to some of our other states nearby Pennsylvania. As was mentioned previously, the EPA is also currently developing under the Safe Drinking Water Act a maximum contamination level for drinking water that will be significantly lower if it's adopted than what Pennsylvania currently has in place. So we'll actually be seeing these standards lowered. But the standards that we're currently operating under, the first phase of monitoring for that actually began at the start of this year for public water systems that are serving more than 300 people, and for bottled vendor, retail, and bulk water haulers. And then the second wave of monitoring around these standards is slated to begin at the start of 2025 for community water systems, as well as non-transient, non-community water systems serving 350 or fewer people. One of the caveats to the progress that we've made in this particular area is the fact that there were multiple other PFAS constituents that showed up in the DEP sampling testing, but were not, there were no process put in place for setting MCLs for those, and those are identified on my slide here. And so there's, I think, precedent and grounds for saying we're seeing other PFAS constituencies showing up in our environment here through testing, and we need to start setting similar standards for those, especially if we're not going to get those standards from the federal government. The other, I think, big piece of progress that is being made is recently Governor Shapiro, in his budget address just last week, has set aside in his 2024-2025 budget $1.5 million to expand testing for PFAS contamination. Next slide, please. But let's get back to like the real crux of where the biggest source of contamination in Pennsylvania is, and the so-called elephant in the room, and that is Class B firefighting foam that contains PFAS. It's been around since the 70s. It's been used for its ability to produce a fast-spreading foam to control flammable liquid fires. And so it's been found to be particularly effective around gasoline, oil, jet fuel, and that's why you're seeing it utilized in things like military bases, airports, storage tanks, any other type of industrial site. Next slide, please. But that being said, we're really raising the profile that we need to start moving away from this type of firefighting foam. The U.S. Department of Defense has already stopped purchasing it just last year. They're going to be phasing out use of it entirely this year. The FAA has also recently authorized airports to use firefighting foam that doesn't contain PFAS. And we've already seen internationally safer alternatives being used at international airports in places like France and the United Arab Emirates. And so building off of that type of progress, we're starting to see this become an area of interest and focus amongst Pennsylvania's General Assembly. There was a committee meeting of the Pennsylvania House of Veteran Affairs and Emergency Preparedness Committee in October, specifically dealing with battling cancer and other occupational diseases and firefighting. But it was really focused on PFAS and how PFAS is impacting our firefighters and what might need to be done in order to not only better protect them, but address the biggest source of contamination in Pennsylvania. There's a link here in my slides, but if you go to the General Assembly's website and that particular House Committee's website, you can find a link to the actual committee hearing itself if you're interested in watching both our testimony there, giving the overall lay of the land for PFAS in Pennsylvania, but also hearing from firefighters and municipal associations around the challenges that they're experiencing with PFAS. Next slide, please. And so that's transitioning us into actually looking at passing legislation here in Pennsylvania that would ban the use of Class B firefighting foam, prohibit the manufacture, sale, or distribution of such firefighting foam, require a manufacturer recall and reimbursement to firefighting entities of that foam, and provide state support for firefighting entities to identify safer alternatives that can replace those that do need to have something like this on site for dealing with those liquid fires. We've seen similar bans pass in other states, as Gretchen had talked about during her slide. So we're really trying to build upon what other states have done in terms of addressing this. And we found ourselves a partner and champion in this effort in Representative Brian Monroe out of Bucks County, who not only represents some of those communities that we talked about as being ground zero for contamination, but is also somebody who has been personally impacted by the contamination that has occurred there. So we have a very powerful spokesperson there. And I think this is not only an appropriate time for doing so, but we're also seeing like we need to have this legislation out there as well, because we're seeing other half measures try to make their way through the General Assembly as well. Stuff that wouldn't totally ban the use of firefighting foam, and language for legislation that's really being pushed by the Fluorine Council and Foam Manufacturers Alliance. So having this alternative out there that really protects our environment and protects our firefighters, I think is a real critical first step. There's other legislation out there dealing with firefighting gear, dealing with some consumer products, and others as well. I strongly encourage you, Clean Water Action partners with Safer States a lot around this issue, and Safer States has done a really great job of chronicling legislation that exists in states, whether it's been passed or being considered, to take a look and see what some of the other avenues Pennsylvania is considering pursuing. But really, from my perspective, our next frontier in dealing with PFAS really is going to be around firefighting foam and potentially firefighting gear as well. And that's the end of my presentation. So I will pass it back to you, Sarah.
Thanks so much, Steve, for bringing us up to speed on some of the overview in Pennsylvania. Next, we're going to go to Amy Goldsmith. Amy is the State Director of New Jersey Clean Water Action, and Amy oversees all of New Jersey's programs for Clean Water Action and the Clean Water Fund. Amy also serves on the board of the New Jersey Work Environment Council, Earthshare New Jersey, chairs the Coalition for Healthy Ports, as well as being an appointee to the New Jersey DEP Clean Water Council. From 1989 to 92, Amy served as the executive director of the Massachusetts Nuclear Referendum Committee, focusing on radioactive waste. And in 2004, she received the Environmental Achievement Award from New Jersey Governor McGreevey. She has a bachelor's in science and land use planning from the University of Minnesota and served for 3 years as a research scientist with the University of Minnesota's entomology department. Amy lives in Red Bank, and I'm going to turn it over to her.
All right, thank you. So glad to be here. I don't have slides, but I will have Molly Clary, who's works with me on this particular initiative, to put in my contact information in the chat. And also, as I mentioned some bills, she'll put some things in there. I also have Marta Young, who's with me, who's our zero waste specialist. And I think Kelly Wilson is with us, who's our ports coordinator. So we have a full team here also to help. So as Steve mentioned, Clean Water Action has a long history of working on PFAS and emerging contaminants, and we have a long history in New Jersey. In 2002, we actually, Clean Water Action urged the DEP to pilot technologies around filtering PFAS and emerging contaminants using activated carbon filters and other options. And that work then kind of went, started here in New Jersey, but then went on up to the EPA. And I think it created some of the energy and the research and the science to get the EPA to go further. We sat on the Drinking Water Quality Institute, which is again focused more on drinking water standards, and we played a key role in what was then the strongest and best drinking water standard in the nation. But now with the new standard from the EPA, everyone will have even a better standard. And there is currently a PFAS right to know bill. It's S1044. It's not passed yet, but it's requiring public education and notices by utilities and landlords of elevated PFAS levels to people, to residences. And while we're not involved in legal action, I noticed there was a lot of people asking about, are we going to sue these guys and gals? Yes, New Jersey is spending a lot of time suing. There are a lot of water utilities that are suing DuPont and Solvay because they produce this stuff and they're based in New Jersey, in South Jersey. There are water utilities that are suing because they have to spend millions of dollars to do filtration. The state attorney generals are suing. So there's a lot of suing going around here, trying to hold, as Gretchen said earlier, to hold the polluters responsible for their wrongdoing. And so that is stuff that, we as an organization will always deal with the legacy issues, but, we can't always just be cleaning up the mess that others have made, right? We have to figure out, and our organization is all about preventing harm. And we work with organizations like Safer States and the Alliance of Nurses to, really push preventing harm and lifting the voices of people who have been harmed so that we can get good long-term changes. So we are currently focused in sort of mobilizing in the state on a variety of different issues. One is, as I mentioned, on the legacy, there's the right to know, but there's also, under the new standard, 80 utilities now have to put filtration on their systems under the current standards, and there's going to be hundreds and hundreds of them under the new standard. That means we're going to have a lot of people really motivated to not just go after the polluters, but also to, turn off the tap, as Gretchen has said. So one of the things that we're doing with Safer States, Toxics Free Future, Mind the Store, is we're working with our other Clean Water Action offices, whether it's Pennsylvania or Minnesota or Massachusetts or Connecticut, to advance bills that would get PFAS out of consumer products. So we have a bill that we're working with Senator Greenstein on. It's S1042. And we're going to follow some of the models of as developed in Colorado, where precedent has been set in banning these substances, and we're hoping to move that along. Senator Greenstein is very motivated around PFAS. She's made this her single issue that she really wants to work on. The other thing that we're keeping an eye out for, and we're very concerned about, and we've seen this in other areas of the work that we do, whether it's waste or other toxic issues, is that industry tries to put in bills that will change the definition of PFAS so that in essence, they don't get regulated, they're not held to account. So we will, there's nothing in New Jersey right now, but we're going to be really super vigilant on this. We know that they're running around the State House in Trenton right now. The other thing, and this is something that all of you, as nurses and in the health profession, one thing that we know has been very effective in the work that we did in Minnesota and elsewhere is that, and we know, that there are many people who have been affected by PFAS. or don't know that they've been affected, but if they heard about somebody else who has and they go, oh gosh, I have those health problems too. Or, oh gosh, I never realized there was a PFAS plume in my community. We want to be able to identify people who have been impacted and to be able to come forward and to speak up in favor of the bills that we're working on now to get PFAS out of products. We feel that, it's been effective in our other states. We want to make sure that we have a human health side to this issue. It's not all about corporations and it's not all about consumerism. It's about our health. And it's so, so important for us to lift those voices. And as Steve said, the person who's this champion is somebody who's been personally affected by it. And how much more compelling can that story be? So if you, know people that know that their drinking water has been contaminated, if you know people who have concerns in New Jersey, let us know. And I just want to say that we work with Rutgers EOSHI, which is a Environmental, Occupational, and Health and Safety Institute. It works with workers as well as communities. They're currently doing a pretty extensive health study in Paulsboro. They're doing blood draws on 800 people who have been willing to participate, and they don't have the results of their work yet, but we know that they are, they literally went door to door talking to people. And if people remember, Paulsboro is a community that's largely Black and poor. It does have a white population, but they're also fairly low income. They live right in the air shed and in the plume of the manufacturing of PFAS. And so getting real data, health data, but also being able, again, to tell the stories is so critically important. So I'm going to stop there, and I'm happy to take questions at the end, but I know that Sarah is going to do the wrap-up section.
Hey everyone, so Sarah Buchik is going to wrap us up. She is a policy consultant with the Alliance of Nurses for Healthy Environments, and which we call Annie. And in her work at Annie, Sarah focuses on outreach to current administrative officials and legislators around Annie's climate policy initiatives. Sarah has been a registered nurse since 2001, with her advocacy grounded in her local community. She formed a grassroots citizen air monitoring group in her fence line community, which performed independent air monitoring and has also worked on successful state-level legislation centered on lead poisoning prevention in children. Sarah has taught undergraduate nursing students both in the classroom and in the community. She holds a master's in psychiatric mental health nursing from the University of Pennsylvania and a postmaster's from the University of Maryland in community public health nursing.
Thanks so much, Hannah. As Hannah said, my name is Sarah. I'm going to try to go through our toolkit, which we will put the link in the chat. Just see here. I can forward my slide. So we do encourage you to go on our website for the Alliance of Nurses for Healthy Environments. While we are a professional nursing organization, anyone can join Annie and it is free. So we encourage you to go to our website, and that is where you'll find our toolkit. So our toolkit that we put together was in response to the National Academies of Science, Engineering, and Medicine, the NASEM guidance. It's a great report, but it's about 300 pages long. So Annie's toolkit provides a number of highlights from this report for healthcare providers who are on the ground so that they can provide useful clinical guidance as people are coming in with questions. As this report was being written, providers, especially those in primary care, were participating in phone calls. This is the NASM report I'm referring to. And they were coming in, saying to the scientists working on the NASM report that, they had concern about what tests should be run for people. People are, presenting to their providers, asking questions. And so this toolkit really is designed for the practitioner in the field. So as has been already discussed, there is going to be some federal legislation. There's going to be, the EPA should be releasing any day now, the National Primary Drinking Water Regulation rulemaking. Essentially, what this means is that starting within the next 3 years, this regulation will fully implement the regulation of 6 PFAS chemicals. So we're expecting this to be rolled out nationwide, and this is going to require municipal water supplies to take action if these water supplies are above a certain maximum contaminant level. This is just to provide you with some background. At the same time, there's this bipartisan infrastructure law that's putting $50 billion to invest in the nation's drinking water. So we have a lot of funding coming into communities, and we also have this drinking water regulations that are coming in. So what that's going to result in is a lot of communities across the United States are probably going to have water supplies that aren't in compliance, and they're going to be brought into compliance, which means people in communities are going to be presenting to their doctors and their nurses and their clinicians asking all kinds of questions. So hopefully some of the things in our toolkit will help clinicians address those. So what can we do as healthcare professionals? So Amy and Steve and Gretchen talked about a lot of the policies that we can engage in. One of the most important things we can do as a clinician is to talk to patients and communities. We can also take part in clinical testing, which we'll go over briefly. We can also look at clinical testing and interpret those results. And we can also provide clinical management and follow-up. So I'll just touch on those briefly. Everything I'm going to talk about is in our toolkit, so it will be there available to you. One of the hardest things with PFAS is that the science and the health impacts of PFAS is still emerging. So there is uncertainty. So having conversations with people and patients surrounding exposure is difficult. And we just want to be honest with people. We want to say what is known and what is not known. And what we do know is that when we reduce exposure to PFAS, the risk is reduced. So we want to review with patients their potential exposure and possible resulting health impacts. We also want to discuss how this science is emerging. There are currently a lack of standardized methods for PFAS exposure biomonitoring. We want to acknowledge these unknowns about PFAS and its health effects. And we really want to encourage our patients to verbalize concerns about exposure, and we want them to engage in conversations with us about possible testing and follow-up. It's really critical we account for how environmental contamination in communities can disrupt life as usual, and how this is really stressful on people. This stress is a really normal reaction to this type of situation, but we really want to acknowledge that and anticipate that. Patients may also have questions to providers about future health problems, about pregnancy, fertility, breastfeeding, immunity for themselves and their families, and just have overall uncertainty. And while we may not have all the answers, we can keep ourselves educated on the latest science and know who to reach out to. So regarding clinical testing, clinicians should offer PFAS testing to those who are likely to have a history of elevated exposure. So to determine exposure risk, patients who are likely to have a history of elevated exposure to PFAS include those who had occupational exposure to PFAS. So if we have a patient who's been exposed to fluorochemicals or served as a firefighter, there's somebody who could be tested for PFAS. Those who have lived in communities where environmental and public authorities like CDC, ATSDR, EPA, or state or local authorities or academic researchers have documented PFAS contamination. If people regularly consume fish from bodies of water with known PFAS contamination, I know both in New Jersey and in Pennsylvania, both of those states have websites that we can go to and look at the fish consumption advisories. So that's another thing we want to ask patients about. And then if a person has lived in areas where PFAS contamination may have occurred, so if your patient lives near a facility that has used fluorochemicals, near a commercial airport, a military base, a wastewater treatment plant, farms where sewage sludge may have been used, near a landfill or an incinerator. As you can see, there's a lot of people who fall under this umbrella. So, but we do want to do an exposure history assessment so that we can understand our patient's background and exposure to PFAS. One of the things that we include in our toolkit is this exposure assessment questionnaire. In the NASM report, that 300-page report, they really don't have specific questions to ask your patients to determine if they're at high risk for exposure. So we adapted this exposure questionnaire from the CDC. They have PFAS exposure assessment technical tools, and they've been using these for a number of years. And we recommend that you use these to assist in determining exposures. This can be printed right out from our toolkit, and it would also be really easy to include in an electronic health record. As a provider, we encourage you to look at the resources in the toolkit and also with these organizations that we featured today, because we encourage nurses and healthcare workers to review, where there is contamination. We want healthcare providers to know about local water contamination, soil contamination, and fish advisories so that they can accurately assess. We can ask patients, but we also want to make sure that we're aware of those things as well. Oops, I'm so sorry. Can you see my screen okay? Sorry, my apologies. Are you able to?
It's still loading. We went to, it looks like you're opening the toolkit again. Yeah, maybe reshare.
I'm going to reshare my screen. So while that's happening, there's another thing. There's currently no standard methods for PFAS exposure biomonitoring.
I put the link into the chat for the toolkit.
How much? All right. Are you able to see my screen now?
Yes.
Okay, great. Thank you. So there's currently no standard methods for PFAS exposure biomonitoring. So in our toolkit, we actually list the labs and codes that can be used to order those labs. Costs for these tests can be fairly high. So it's important to do exposure assessment prior to ordering, as it may not be covered by insurance. Healthcare providers, so this is a really great advocacy point. We really want to be pushing insurance providers to cover these tests. These can be $700 to $1,000 on average. And in areas with high confirmed contamination, we as healthcare providers can advocate for industries, to cover some of these costs for folks. Testing for PFAS is also only for a handful of PFAS chemicals. So even though we can test people for PFAS, it still gives us a somewhat incomplete picture of exposure. In our toolkit, we talk about the laboratories. The thing with PFAS and laboratory testing is the labs that offer PFAS testing, they are not subject to measurement and standardization, nor do they need to comply with clinical certification for reporting of results to patients. So that is another area that we as healthcare providers can advocate. Our guide does review what criteria you want to make sure a lab has that does PFAS testing, and providers can use any lab as long as they use EPA method 537.1. And we discuss this in our toolkit. This is from the NASM report. Our toolkit outlines what the NASM recommendations were. This includes lab results interpretation. So, you send out some blood work and you get it back. So what next? The health risk from PFAS exposure is estimated to increase with increased exposure. So you can see here it's less than 2 to 20, and then above 20 nanograms per milliliter. So the health risk from PFAS exposure is estimated to increase with increased exposure. And so those above 20 are likely to have a higher risk of health outcomes than those at lower levels. So as a clinician, we want to be sure that we're doing adequate clinical management. So we want to do some additional testing and follow-up. We want to do regular examinations for testicular cancer, breast cancer, screening for ulcerative colitis, check blood pressure during pregnancy. And then these are some potential labs as well: lipids, liver function, serum creatinine, and thyroid tests. And we also want to have ongoing conversations with our patients about things like breastfeeding and water testing. We want to anticipate those conversations and, have those conversations. The biggest thing we can do, though, with PFAS is try to prevent it. Ultimately, this is really where clinicians, we want to focus on this primary prevention. So, for example, if you have a patient working with fluorochemicals or a firefighter, we want to look at ways that, we can work with occupational professional associations to reduce those exposures. We can advise them if they have PFAS in their drinking water, how they can go about testing their water and filtering it out. We have information on that in our toolkit. And we also want to advocate for, making this accessible for everybody. We know a lot of these things have costs, and so we want to make sure that this is something that everybody can do. There are a number of barriers right now, and all of these barriers are places where we see healthcare providers specifically being able to, take action. As I said, testing methodology right now, it's complex. Only a certain number of PFAS can be detected. There's a lack of data standardization. There's a lot of different healthcare providers that's not, coordinated. There isn't, necessarily funding for things, but each of these barriers is an opportunity to engage in advocacy. We can advocate for data to be reported in clear manners, to be, to work to bridge the divide among disciplines and make our voice heard, and advocate for further information dissemination to patients and providers. There are so many regulatory actions needed. I know Amy and Steve and Gretchen talked about a number of areas that you can get involved. But as healthcare providers, we can really be advocating for things like asking, urging the FDA to put PFAS limits in bottled water, speaking up about the importance of OSHA, creating, limits for PFAS. There's so many areas that we can really be pushing for safer substitutes, having a national PFAS testing program, reforming Toxic Substances Control Act. A lot of these things are mentioned in our toolkit, but they're all areas that we can engage. I'm going to give you my contact information, so please do reach out to me with any additional questions, but we do refer you to our toolkit. It has a great amount of information, and it has a lot of links in there about how to stay up to date and current. So I'm not sure if we have any questions. We have a few minutes if we could get to some questions in the chat. I know one of the questions was, I think this was for Steve, there was a representative you had mentioned. I'm not sure if you saw that for Bucks County.
I didn't see the question itself, but if it's referring to the representative that was in my presentation, it's Representative Brian Monroe, who's from Bucks County, representing part of that ground zero contamination area of Horsham, Warminster area, who's looking to champion, who will be championing our banning PFAS in firefighting foam legislation.
Great, thank you. I am going to stop